Thanks to the vision and courage of this state's leadership, Connecticut is now poised to be among the front ranks of American states in implementing health reform in a way that will slow healthcare cost growth, improve quality, and expand coverage to the currently uninsured. The basic vision of SESTANET is to provide high-value 21st century healthcare to state employees, retirees, Medicaid consumers, and Husky families. More than 150 volunteer experts are working with the SESTANET board to try to achieve this goal, and have been for months. And as a result, the state is poised to go far beyond many of its counterparts elsewhere in the country in implementing reform quickly. Let me give you a couple of examples. The federal health reform bill provides $5 billion in funding to subsidize early retiree coverage. In order to access these funds, an employer needs to implement measures that slow the growth of healthcare costs for the chronically ill. Responding to the SESTANET law, the comptroller is already meeting this requirement, and in fact did so before the federal law passed by putting out to bid an RFP, a request for proposals for state employees and retirees, to implement a new model called the patient-centered medical home model, where in addition to regular medical care, people get care coordination, patient education, help with transitions from hospital to home, and 24/7 availability of appropriate consultation. That is already in place, and that qualifies Connecticut to be at the front of the line in accessing a finite number of federal dollars that will be critically important in helping the state meet its tremendous budget challenges that it faces today. Another example, with us today is Ellen Andrews, who's the co-chair of the Medical Home Committee of the SESTANET Board, and thanks to the hard work of Ellen and her colleagues, the state will be able to implement a patient-centered medical home model for Medicaid, and that will put the state in a position to receive 90% federal matching funds for chronically ill patients enrolled in that system, and to be, again, at the front of the line for a limited pot of planning dollars. Many other states are nowhere near Connecticut in being ready for this reform, and Connecticut is poised to jump ahead and meet the challenges of healthcare in the 21st century in a way that will help the state's budget deficit and help the state's citizens in slowing healthcare cost growth and improving quality. So it's really an honor to be with you today. Thank you very much.